Now coming to the question number 2. Here you have got a 15-year-old girl who is presenting with the vision 20 by 30 OD. Now by now you should know what is OD and OS. This you should know. OD actually means the right eye, and when I say OS, this is your left eye. Now her CT scan shows abnormality. The most unlikely finding. What they are asking is unlikely. They are not asking you likely. They are asking you unlikely. So this question language is again very important. So look at this picture, what you are getting here. If you look at the picture, this is your eyeball here. Can you see the CT scans? Okay. And here this is the optic nerve, which is actually normal. But here you are seeing the enlargement. Now, can you tell me what kind of enlargement is this? This is typically called as the fusiform. This is typically called as the fusiform enlargement of the optic nerve. Can you tell me where do you get this fusiform enlargement of the optic nerve? This is actually found in the optic gliomas. This is found in the optic gliomas, and optic gliomas are a kind of tumors. What kind of tumors they are? They are the pilocytic tumors. These are actually the pilocytic tumors, and these tumors could be found in the optic nerve as well as in the optic chiasma. They could be found in the optic nerve as well as optic chiasma. Now where they are found? They are actually found to be associated with the neurofibromatosis 1, right? Now let us see the question and then you try to answer. The most unlikely finding. Number 1 is pigmented iris lesions. Number 2, a brother with the same problem. Then a good vision after surgical resection of the lesion, and propensity to develop CNS tumors. So write the answer in the comment section. What do you think is the answer? This person most unlikely to have what finding? Pigmented iris lesions, brother having the same problem, good vision after surgical resection of the lesion, or propensity to develop the central nervous system tumors. Now as I already told you that we have got the optic gliomas, and these optic gliomas are actually known to be associated with the neurofibromatosis 1. Right. Now what are the other things that you get in neurofibromatosis 1? Come on, we have got the cafe or late spots, right? Then we also have the axillary freckling. We have got the axillary freckling. Then you also have the Lish nodules. You also have the Lish nodules, and Lish nodules are actually the iris hematomas. These are actually the iris hematomas. So if you look at this, that number 1 is pigmented iris lesions. Yes, I can have the pigmented iris lesions because we can have the iris hematomas. So this is actually a true statement. Okay. Now the option number B is that the brother can have the same problem. Now this is again a true statement because you know neurofibromatosis 1 is autosomal dominant. So if it's a dominant condition, obviously brother can have the same condition. Then number 3 is good vision after the surgical resection of the lesion. Okay, I'll come back to this. Number 4 is propensity to develop the central nervous system tumors. Now, this is again a fact, you know, that if you look at the patients of neurofibromatosis 1, about 30% of the patients will develop the optic gliomas, right? And they also have the propensity to develop the CNS tumor. So this statement is also true. So most unlikely is actually the option number C, good vision after the surgical resection of the lesion. Now what happens if you look at the appearance of the CT scan? It is a fusiform enlargement, right? And most of these babies can also present with the proptosis. If you remember, when we had the integrated session on the proptosis, we had also discussed this, that it can be a cause of the proptosis also. Now, many of the students get confused between the optic gliomas and the meningiomas. So, that is why I try to keep the image, CT scans image of the meningioma also. In the meningioma, if you see, we typically get the tram track appearance, right? So Dr. Rajat also told you that we get the tram track appearance, and this is by far the best image that is available of the meningioma. So you are getting this kind of appearance which is not there in the optic glioma. So you have to be very, very clear. Plus, if there is a optic glioma, you will be getting the associated features of the neurofibromatosis also. So that should be very, very clear. Okay. So this is a case of glioma. Now, once you are sure that this is a case of glioma, Why it is unlikely to have the good vision? See, most of the cases, because it is involving the optic nerve, so visual acuity has to be affected and vision loss has to be there. Now, because it is involving the optic nerve as a whole, we have got the fusiform enlargement of the optic nerve as a whole. So, when we try to treat it, we have to remove the optic nerve. There is no, option where I can just save the optic nerve and remove this tumor. And that is the reason we try to postpone the surgery to the last as much we can, because there is no way that we can save the optic nerve. So, obviously, one cannot have a good vision after the surgical resection of the lesion, a very important aspect. Second important thing is, obviously, this will affect the vision in the patient because this is affecting the optic nerve. So, the systemic part, that it is associated with the neurofibromatosis, the genetic part, that it is autosomal dominant. Then the ophthalmology part, the lesion nodules, the radiology part, that is your fusiform. And then you have got the this neurological part, it is associated with the CNS tumors, and ultimately the treatment part, the surgery part, that it will have a good vision after the surgical resection is a wrong statement. I think this is very, very clear. And again, an important question, that is checking and testing your so many subjects knowledge. So factual knowledge is required, because some of the students also messaged us that is the factual knowledge important or we should forgo now. So obviously, for solving the clinical questions also, you require that factual knowledge. Don't lose it. Keep on, getting hold of it and revise your volatiles. That is very, very important.